Welcome. Today we're focusing on a group of conditions known as demyelinating diseases and how they can impact the eyes. We'll explore what they are, how they affect vision, and what can be done to manage them. Prepare to delve into the complex world of the nervous system and its intricate connection to our sight. The precise cause of most demyelinating diseases remains a puzzle, but current understanding points towards a combination of genetic predisposition and environmental triggers. In essence, some individuals possess genes that make them more susceptible. Then, exposure to certain environmental factors, such as viral infections or even vitamin deficiencies, could potentially initiate the autoimmune response that characterizes these conditions. The body mistakenly attacks its own myelin. Demyelinating diseases, as the name suggests, are characterized by damage to the myelin sheath. Think of the myelin sheath as the protective insulation around nerve fibers, like the plastic coating on an electrical wire. When this sheath is damaged, it disrupts the efficient transmission of nerve signals. In the context of vision, this myelin damage can affect the optic nerve, which carries visual information from the eye to the brain, or even pathways within the brain itself that process vision. This disruption leads to a variety of visual disturbances, depending on the location and extent of the demyelination. The inflammation associated with the attack on myelin further exacerbates the damage and signal disruption. The prevalence of demyelinating diseases varies depending on the specific condition. For example, multiple sclerosis, one of the most common demyelinating diseases, has a higher prevalence in regions further away from the equator. Factors such as genetics, ethnicity, and environmental exposures all influence the distribution and incidence of these diseases across the globe. Research continues to investigate the specific epidemiological patterns to better understand the risk factors involved. The visual symptoms caused by demyelinating diseases are diverse and can fluctuate. Optic neuritis, inflammation of the optic nerve, is a frequent manifestation. This can lead to symptoms like blurred vision, decreased color perception, pain with eye movement, and even temporary vision loss in one eye. Double vision, or diplopia, can also occur due to demyelination affecting the nerves that control eye movement. Nystagmus, involuntary rhythmic eye movements, is another possible symptom. The specific symptoms, their severity, and duration vary widely from person to person. Diagnosing demyelinating diseases often involves a comprehensive approach. A thorough neurological examination assesses reflexes, coordination, and sensory function. An eye exam, including visual acuity testing, visual field testing, and examination of the optic nerve, is crucial for detecting visual abnormalities. Magnetic resonance imaging, or MRI, of the brain and optic nerves is a key diagnostic tool, revealing areas of demyelination known as lesions. In some cases, evoke potential studies, which measure the electrical activity of the brain in response to visual or auditory stimuli, can help detect subtle nerve damage. Spinal fluid analysis may also be performed to look for specific markers associated with demyelination. While there are many demyelinating diseases, the most well-known is multiple sclerosis, or MSS, has several subtypes, including relapsing remitting MS, secondary progressive MMS, primary progressive MS, and progressive relapsing MS. Each subtype has a different disease course and progression pattern. Other demyelinating diseases include neuromyelitis optica spectrum disorder and MOSD, which primarily affects the optic nerves and spinal cord, and acute disseminated encephalomyelitis ADM, which is often triggered by a viral infection or vaccination and affects the brain and spinal cord. Currently, there is no cure for most demyelinating diseases, but a variety of treatments can help manage symptoms and slow disease progression. For acute attacks, high-dose corticosteroids are often used to reduce inflammation. Disease-modifying therapies, or DMTs, are available for MS and MOSD and aim to reduce the frequency and severity of relapses and slow the accumulation of disability. These therapies work by modulating the immune system. Symptomatic treatments, such as medications for pain or muscle spasticity, are also important for improving quality of life. Visual rehabilitation, including low vision aids, may be helpful for individuals with persistent visual impairments. Since the causes of demyelinating diseases are not fully understood, primary prevention is challenging. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and adequate vitamin D levels, may be beneficial. Avoiding smoking is also recommended, as smoking has been linked to increased risk and disease progression in MS. Prompt treatment of infections might also play a role in preventing certain demyelinating conditions, such as ADM. The prognosis for individuals with demyelinating diseases varies considerably depending on the specific condition, its severity, and the individual's response to treatment. Some people may experience mild symptoms and minimal disability, while others may have more significant impairments. Research is ongoing to develop new and more effective treatments, including remyelinating therapies that aim to repair the damaged myelin sheath. Gene therapy and stem cell transplantation are also being explored as potential future treatment options. Understanding the disease mechanisms at a molecular level is crucial for developing targeted therapies that can halt or even reverse the damage caused by demyelinating diseases. Recent studies have focused on identifying specific biomarkers that can predict disease progression and treatment response, allowing for more personalized and effective management.